Okay, we're going to go ahead and transition into illnesses and how we treat these in the back country. So let's start off with stomach aches or abdominal problems. Your book refers to them as stomach aches. It's more commonly known as just an abdomen issue because a lot of times we don't know what the cause of that is, and it could be intestinal as well. But when you're checking for a person, just like before when we talked about, you're going to look, listen, and feel. Okay, and what you're looking for is gradually increasing or widespread abdominal discomfort. So, meaning that it's not really a specific place, one place. It's just overall my abdomen hurts or is bothering me. And you're going to want to track this over time. Okay, cramping, if that comes and goes. Is there nausea? And does that result in vomiting? Is there any sort of relief at that point? And diarrhea. To give care for this, we don't do a rapid evac for abdominal pain. We do if it continues to get worse or becomes more severe, which we'll talk about shortly. But as far as just like that overall stomach irritation or pain, we're going to keep the person as hydrated as possible. Make sure we're keeping them on a bland diet. Think of what we would do at home, right? We wouldn't give someone a spicy dish or a spicy food. And then maintain good hygiene, as this can be something that if it is some sort of viral or bacterial issue that is contagious, it can become very contagious very quickly in the group. So it's not just as much the person's hygiene as much as it's the entire group's hygiene. And what we've talked about in the past, wash your hands, wash your hands. So diarrhea is when we think of things as starting to get more irritated or more severe. So is this a one-time diarrhea, or is this a frequent loose watery stool that continues to happen? This could be the presence of some sort of stomach flu that, as we are learning these days, right, is in fact very contagious. So for mild diarrhea, we're just going to give care, and some of the things that we want to keep in our first aid kit is an antidiuretic to help people with this, and we just want to make sure that we're keeping people hydrated with water and any sort of sports drink or noon tablet that we have in the back country. If the person is not vomiting, go ahead and give them rice, grains, bananas, not likely to have in the back country from a backpacking standpoint, but when we think about big, huge backcountry trips, we do have actual fruits in the backcountry, okay? We want to avoid those fats, dairy, caffeine, or alcohol. Those are major triggers to continuing diarrhea. If the diarrhea persists, then we want to start giving this person electrolytes to replenish them. And as things continue, if it continues to get worse and worse, we do want to evac that person if we don't feel like their diarrhea is subsiding. Serious abdomen pain. So this is where we're talking about someone being debilitated because of this abdomen pain. This is absolutely a rapid evac. We're talking about an possible infection that is near vital organs or a part of vital organs, and this requires removing someone from the back country so they can be properly treated. If you happen to have a thermometer on you, a fever of higher than 102 is what we call a rapid evac. Okay, so we're evacuating that person. Present chills or shivers. This also means that they are contagious, right? Or there's the potential for them to be contagious to other members of the group. If this abdominal pain continues for longer than 12 hours, it is also an evac. If the person is guarded, if there's tenderness, stiffness, and it becomes to the point of, like I said, debilitating, if there's blood in the vomit, feces, or urine, rapid evac, okay? So any sort of major symptoms, if at any time you're feeling scared for this person's safety and you feel like it could get past the point of them being able to evac themselves, or it is past the point of someone being able to hike out themselves, then we're going to want to evac them. Okay, so what are we looking for? To give care, if we're only going to give care, we're going to do our ABCDs like we talked about in the last video. And we're going to watch for signs of shock. We will talk about shock in a later video. Give nothing by mouth unless evacuation will be delayed by more than a few hours. Make sure that they're sipping on water, okay? As far as guidelines, when you're leaving, you evac slowly. If someone persists with discomfort, you evac quickly. If the signs and symptoms become serious, you can also call for help. Anything around major organs, we want to make sure to evac as quickly as possible.